Hello again, dear readers. This is per the Spectator. The title of the article is below, but definitely I will get you a link to this so you can check it out yourself per the Spectator. These are screenshots that I took because the actual website was giving me issues like subscribe. So at last, we're getting a debate about COVID 19 modeling. When people finally got to look under the hood of the famous Imperial College study, they found twisted and tangled code, and most of the model's prediction bear little resemblance to what is actually happening. Some defend the models by saying that their predictions turned out to be wrong only because governments imposed harsher restrictions than the coders expected. If so, we have a perfect experiment. Sweden did not close borders, shut down schools, businesses, restaurants, gym, or shopping centers, and did not issue stay-at-home orders. So it should be the one country where the models fit. Let's see. Maria Gunther and Maria Westholm at Dagens Nyheter, Sweden's biggest daily, just took a look at two of the most influential models in Sweden. Both were inspired by the Imperial College study and published on the preprint server MedRxiv in April. Both were used by critics to argue that the Swedish model would quickly break our healthcare system and that we had to make a U-turn into lockdown as Britain did. Here are the model's predictions of the number of COVID-19 patients in Swedish intensive care units. ICU, the highest curve is a model without lockdown. Jardine et al. H. Jardine et al. COVID 19 healthcare demand and mortality in Sweden in response to non pharmaceutical mitigation. Then suppression scenario, 7th of April. The graph suggests critical care demand would peak above 16,000 patients per day by early May, and pre-pandemic intensive care unit capacity would be exceeded 30-fold. So as you see there, again, the model's prediction, the highest curve is a model without lockdown. So this is what they were predicting. One reason why the models failed is that they, just like most countries' politicians, underestimated how millions of people spontaneously adapt to new circumstances. So this is probably like the cases they had here. Then came J. Gardner et al. Intervention strategies against COVID-19 and their estimated impact on Swedish healthcare capacity, 15th of April. It was an even more pessimistic assessment, showing a peak of over 20,000 patients by early May, with an ICU requirement around 40 times the actual capacity. Here's a graph. This again is probably what they predicted and what it was. Maybe we'll continue. Sweden's public health agency rejected the models. It instead planned for a worst case scenario that was much less pessimistic, suggesting a peak around 1,700 ICU patients in the middle of May, still more than 3 times more than the pre-pandemic capacity. Sweden, almost alone in the world, refused to lock down, and here is how things eventually worked out. In case you can't see it, that's it. The number of patients in ICU has been fairly stable, around 500, 550, since mid-April. This means that capacity was never exceeded. At this moment, when the model suggested that Sweden would have 30 to 40 patients fighting over every available ICU bed, there is spare capacity in beds, equipment, and personnel of around 30%, partly as a result of a doubling of the pre-pandemic capacity. Gardner et al. Predicted that Sweden would have 82,000 COVID 19 deaths by the 1st of July. That implies around 1,000 deaths every day since the paper was published in mid April. However, the total number of Swedish COVID 19 deaths at the time of writing is 3,313. There goes that. There goes that. Anyways, one reason why the models failed is that they, just like most countries' politicians, underestimated how millions of people spontaneously adapt to new circumstances. They only thought in terms of lockdowns versus business as usual, but failed to consider a third option, that people engage in social distancing voluntarily when they realize lives are at stake and when authorities recommend them to do so. And obviously, there is an argument that these models scare us into changing our behavior and ramping up capacity, and so helped us to avoid a disaster. But they were also clearly based on faulty assumptions that would always result in absurd predictions. We know this because both models actually assumed that it was already too late and estimated that ICU capacity would be exceeded by around 10 times, even if Sweden switched to strong mitigation. The need for ICU beds in Sweden will be at least tenfold greater than capacity if strategies approximating the most stringent in Europe are introduced by 10th of April, wrote Gardner et al. Those strategies were never introduced in Sweden, and yet additional ICU capacity is 30%, and the number of patients in intensive care has been declining for 2 weeks. The newly constructed field hospital in Stockholm, with room for hundreds of patients, has still not received any patients. It will probably never have to open. Here's a zoomed in graph of eventual ICU numbering in the hundreds, not the predicted thousands. Number of COVID patients in intensive care in Sweden. Take a look at that. The number of COVID patients in intensive care in Sweden. In Britain, it's argued that if the number of COVID deaths is far lower than the models predicted, well, this is the result of lockdown. Some even argue that the difference between the predicted and the actual is the lockdown effect. But you can't say that for Sweden. We banned gatherings of more than 50 people, but that was about it. All other behavioral change was voluntary, something the models did not properly understand. As countries plan how to leave lockdown, they can look at Sweden and ask what happens if you don't involve the police, if you don't issue edicts about how many of your relatives or neighbors can visit, and just ask people to be careful. Might that work? The Swedish experiment casts huge doubts on the models and makes the case for trusting the public. That was written by Johan Norberg. Again, per the Spectator. And I'm gonna flip it real quick on ya, dear reader, so we can go to the actual website real quickly and you can see the name of the. This was May 12th, 2020. Today is May 26th. It's 2:21 p.m. This was on May 12th at 9:48 a.m. from Johan Norberg. Can we trust COVID modeling? And that is people enjoying Stockholm in the time of COVID. As you can see, no mask. The baby's all right. Look at him right there. He's like, whatever. There's the article. And let me know what you think in the comment section below. Can we trust the COVID modeling?